Hey there. Let's dive right into this. Menopausal hormone therapy, MHT, it can be, well, confusing. And we've got some research here today, a big review of studies actually, about, who should and shouldn't consider MHT. And we know you don't have time to read every medical journal out there.
What's really interesting about this particular research is it goes beyond just like the general guidelines. They looked at over 250 different scenarios.
Wow.
Yeah, so like factoring in all these different medical conditions, types of MHT, really getting into the nuances.
So not one size fits all.
Exactly.
Okay, so this research, by the way, was published in Metritis, which is, a leading journal in this area. So it gives us a much more personalized look at MHT.
Yeah, and they really analyzed a ton of data to figure out like, okay, when is MHT likely safe and effective? When might the benefits outweigh the risks? Or, when is it probably better to look at other options?
Okay, so let's break this down a little bit. What are some of the main factors they considered?
Well, they looked at things like your age, how long you've been in menopause, if you have, say, diabetes, heart issues, even migraines.
Oh, wow.
And they factored in all the different ways that, MHT can be taken: oral, transdermal, estrogen only.
It sounds incredibly thorough.
Yeah,
So for someone who's maybe a little hesitant about MHT, what would you say is like the most important takeaway from all of this research?
that's a great question. I think the biggest takeaway, and this might surprise some people, is that MHT is considered safe or even beneficial in most cases.
Really?
Yeah,
That's huge.
it is huge. It really challenges that kind of outdated view
Hmm.
that, MHT is automatically risky. Only about 14% of the scenarios they looked at raised any red flags where MHT should, like, potentially be avoided.
Mm.
So for a lot of women, the benefits of actually managing those often really difficult menopausal symptoms, they likely outweigh the potential downsides.
That's so important for women to hear. It's about having the information so you can make a good decision with your doctor.
Exactly, yeah. And this research gives you a really strong starting point for those conversations.
Now, they didn't just look at if MHT was safe or not, they actually created categories to kind of help guide these decisions, right?
That's right, yeah. They used the World Health Organization's international nomenclature to categorize MHT eligibility.
Okay.
So that means they were looking at, were there no restrictions for MHT use in a certain scenario, or did the benefits outweigh the risks, or, risks generally outweigh the benefits, or should not be used.
Okay, that makes sense. So it's not just like a yes or no on the MHT. It's really looking at, your individual circumstances and kind of weighing those pros and cons.
Exactly. Yeah. It's about finding that sweet spot, between managing your symptoms but also minimizing any potential risks. And that's going to be different for everyone. And that's another reason why that open communication with your doctor is so important.
Yeah, I can see how this research could really change the conversation that women are having with their doctors.
Absolutely. Yeah. It's about moving away from that old doctor knows best and more towards like a team approach.
I like that. So, speaking of personalized approaches, I noticed age played a big part in the findings.
It does, yeah. They found some really interesting distinctions based on age. Like, for
Hmm.
example, for women under 40 who are experiencing, premature menopause or premature ovarian insufficiency, as it's often called now, MHT is generally encouraged.
That's right. And the recommendation is to continue MHT until around, what we think of as the average age of menopause, which is what, 50, 51? Why is that?
Well, the idea is it kind of mimics that natural protection that estrogen provides against things like bone loss, heart disease, stroke risk, even dementia.
Oh, wow.
Yeah, so it's
Yeah.
like bridging the gap until they reach a more, I guess, typical menopause age. But then what happens at that point? Like, if you've been on MHT for premature menopause, do you automatically stop? That's where, again, that conversation with your doctor is key. You discuss whether to continue, weighing those benefits and risks, just like anyone else going through menopause.
So it becomes much more individualized at that stage. Okay,
Mm.
so what about women who start menopause, say, in their 50s or 60s?
So for women in that age group, starting MHT within 10 years of menopause is generally considered pretty safe, according to this
So
research.
there's that 10-year window. It
Yeah,
seems like that's kind of a recurring theme here.
yeah, it seems to be.
But things get a little more, I guess, nuanced as you get into your 70s.
Exactly, yeah.
Yeah.
The research is more cautious for that age group, so really carefully weighing those potential risks and benefits becomes even more important.
Which makes sense, right? We often see like more individualized approaches in medicine as people get older. Just, I guess, there's more to consider.
Yeah, absolutely. There are more factors at play. It's about finding that right balance, right?
Hmm.
Managing symptoms, but also being mindful of any potential risks. And again, that balance is going to be different for everyone.
So, no matter your age, that open communication with your doctor is so key. Now, we've been focusing a lot on like when MHT might be a good option, but let's talk about those red flags for a minute. Are there situations where the research suggests like, maybe MHT isn't the best choice?
There are, and we touched on one earlier, blood clots. That's definitely a scenario where the research gets really specific.
Right, because it's not a like blanket no to MHT if you've ever had a blood clot.
Exactly. So if you have a history of venous thromboembolism, which includes things like deep vein thrombosis, pulmonary embolism, and you are not currently on blood thinners, then MHT might be considered, but very cautiously.
So it could still be possible, but it requires a really careful discussion with your doctor. What if someone ALS on blood thinners, though?
That's where the research really leans toward avoiding MHT, especially the kind that's taken orally.
Okay, so in that case, a doctor might, suggest other ways to manage those menopausal symptoms.
Exactly. And luckily, there are a lot of effective options out there. Lifestyle changes, non-hormonal medications.
Mhm.
It's about finding what works for you as an individual.
Yeah, like having a whole toolkit. So we've got blood clots. What other conditions were kind of flagged as, I guess, potentially problematic with MHT?
Well, heart health was another big one. If someone has had a stroke, for example, especially one that was related to hardening of the arteries, MHT is generally not recommended.
Okay, that makes sense. I'm guessing there are exceptions to that rule, though.
There are, for instance, a younger woman who's had what's called a hemorrhagic stroke, so that means a bleed in the brain, but no history of heart disease,
Hmm.
or other risk factors like diabetes, smoking, high blood pressure, high cholesterol. She might still be a candidate for MHT.
Again, it comes back to that individual evaluation. Now, migraines are super common around menopause. Did the research look at that at all?
They did. So for migraines without aura, those warning signs some people get before a migraine hits,
Mm.
MHT is generally considered safe. In fact, using MHT continuously might even help prevent those estrogen withdrawal migraines that some women experience.
Oh, that's good to know.
Yeah,
But if you get migraines with aura, it's a different story.
unfortunately, yes. The research recommends against MHT for women who experience migraines with aura because there's concern that it might increase their risk of stroke.
So again, it's all about carefully assessing those individual risk factors and having, those really open and honest conversations with your doctor. But we can't talk about women's health without addressing the C word. What did the research have to say about MHT and cancer?
That's a big one, and understandably a source of anxiety for a lot of women. So let's start with breast cancer, which is often top of mind. The research suggests that for women who've had breast cancer that was not driven by hormones, meaning their tumors were what we call hormone receptor negative MHT, could potentially be an option.
Okay, so there's a possibility there. But what about women whose breast cancer was fueled by hormones? So those with hormone receptor positive breast cancer.
In those cases, the research really advises against using MHT, as it could increase the risk of the cancer coming back.
And what about women who are carriers of the BRCA1 or BRCA2 gene mutations? Those are linked to a higher risk of breast and ovarian cancers, right?
Right? That's another area where caution is advised. The research suggests MHT could potentially be an option for BRCA1 carriers, but it's a nuanced discussion for sure. And they recommend against it for those with a BRCA2 mutation.
It seems like every type of cancer, even every gene mutation, has its own set of considerations.
Yeah.
What about gynecological cancers? Were those addressed in this research?
They were. So for women who've had ovarian cancer, the research actually suggests that MHT might be associated with longer survival and a lower risk of recurrence.
Whoa, really? That's surprising.
It is interesting. And this protective effect seemed to be particularly strong for women under 55. And there didn't seem to be a difference based on the type of MHT used or how it was administered.
So that's a bit of good news for some women with a history of ovarian cancer. What about endometrial cancer? So that's cancer of the lining of the uterus.
For endometrial cancer, the research suggests MHT is generally safe and might even be linked to a lower risk of recurrence,
Hmm.
especially with the combined MHT as opposed to estrogen only. Although I will say there's limited evidence on this particular topic, so more research is definitely needed.
It sounds like when it comes to MHT and cancer, there's no easy answer. Some potential benefits, some risks, a lot of depends.
Yeah, and that's exactly why, having this knowledge is so powerful. You can actually go into those conversations with your doctor with a better understanding of Like, okay, what are the potential risks and benefits for me based on, my history?
Right. It's about being informed and advocating for yourself. So we've covered a lot here, specific conditions, those broader concerns about cancer. Did the research look at any other types of cancer at all?
It did. They actually looked at the impact of MHT on a few other cancers as well, like colon cancer, lung cancer, melanoma. And for those, the research suggests that MHT is generally safe and it doesn't seem to increase the risk of those cancers coming back or being fatal.
Well, that is reassuring to hear. As we've been going through all of this, something that's kind of struck me is the focus on physical health.
Hmm.
But obviously, menopause affects so much more than just our bodies, right? What about mental health? How does that play into decisions about MHT?
That's such a good point. This research, it was really focused on those physical conditions, but mental health is a huge part of, how women experience menopause.
Absolutely. It can affect everything: mood, sleep, anxiety. It's not just about hot flashes and night sweats.
No, not at all. And those mental health aspects, they definitely can influence decisions about MHT. Because for some women, MHT might actually help improve their mood or reduce anxiety.
Okay.
But for others, it might have the opposite
So it's
effect.
like this whole other layer to consider.
It is. And unfortunately, there isn't as much research out there specifically on, like, the relationship between MHT and mental health conditions.
Right. And that just highlights, again, why that open communication with your doctor is just so important. Being honest about your mental health symptoms and really having a conversation about whether MHT is right for you, weighing, both sides, the potential benefits, but then also any risks.
100%. It's really about, looking at the whole picture.
Mm.
Your physical health, your mental health, your lifestyle, what's important to you, and then making a decision that feels right.
And that's really what this deep dive has been all about, right? Giving you the information, the confidence to be a real participant in your healthcare decisions.
Exactly. Moving away from that old doctor knows best and towards a more like, I guess, collaborative approach where you're really part of the team.
I love that. Well said. So, as we kind of wrap things up here, what's your final, I guess, takeaway for listeners who are maybe trying to figure out this whole MHT thing?
I think the biggest takeaway is, MHT is a big decision. There's no easy answer. There's no one size fits all. So gather the information, understand the potential risks and benefits, and most importantly, have those really open, honest conversations with your doctor so you can make the best choice for you.
And this research gives you such a good foundation to start those conversations.
Absolutely, yeah.
It's about, being empowered, asking the questions, advocating for yourself, and making those informed decisions about your health.
Yes, love that. It's your body, your health journey.
And knowledge is power. Keep learning, keep those questions coming, and keep advocating for yourself. We'll catch you next time for another deep dive.